safety. But with that, I want to welcome his studio guest, when our Dr. David Jalloh. Good evening and welcome to the program.
Good evening, my sister.
Okay, today,
good evening.
as today inside the program, we talk about family planning, options, myth, facts, and safety. So let's start first for tell family first. Waiting our family planning.
Thank you very much. So family planning from the water way already. Now a process we try for plan your family, how many pick you want get, and who still you want get them.
Okay, so as this na process where you try for plan, let's look at the different types of family planning and way we get.
So in the process of doing family planning, you get education, and in that education will dedicate you. They dedicate you on the options where they are available. And the option they are available, different options in the. You get the hormonal option, then you get the non-hormonal option. So in the hormonal options, you get medications where they give you, where they mimic the natural body system, because naturally for women, so it might be very specific. Women and them actually they conceive and then they get pregnant. So in the monthly process, or when they don't get belly, you get hormones where they produce. Those hormones they inhibit certain areas in the body where they make. For men, they don't get belly. So they can call it ovulation. Once someone don't get belly, they ovulate. So because they see say population they increase, so through scientific research, they find a way where they go actually for curb woman not go get belly, or for space, just as I mentioned, family planning. So in so doing so, the hormonal aspect of farm involves certain medications that we are saying. It can be a combined or a contraceptive where involve two medications then, which involve estrogen and progesterone. It can be progesterone only pill, where not only one set of medicine we get. It can be injectable, what they call depot. Then it can be intrauterine device, where not hormonal medication also, what they call Marina. They even get what they call patches, where they put them. They even ring hormonal medication in there. And then the non-hormonal them actually then a device the way they use also for make the woman not get belly. And then they can get like copper teeth, and they can get barrier methods them where they can also use, we also they as a non-hormonal.
So let's look at the hormonal one then where you don't mention when are the different. Would that's them supposed for taking any type of family planning in there?
Well, as you say, family planning it is for both sex, but most time actually because woman in then they get belly, so it's more easier actually for able actually for stop them for go belly rather than the man. Though actually in a man and woman they form, they get affair for form picking, we involve the sperm and the oocyte or the egg of the woman. But as you say that the woman get the uterus, we actually they conceive, where they actually take the picking or the picking start the picking the pulling down. So once you go actually for family planning, they get for actually take it easy. If woman we don't born with a cumbra less than 6 months, we not go give combined or contraceptive, because by so doing you go dry the milk of the woman and the woman get for suck baby. So when you go there, basically, if you not possible don't born, where then get the rule of 3 and rule of 6 where then they use. So other medication don't go give you, whether like progesterone or progesterone only pill, way more safer for woman. If a less than 6 months where it don't born, you could give them. But above 6 months, they combine or contraceptive can be more appropriate. You get implant that they can use, what they can call, what they can put on the arm. Also another form of contraceptive and progesterone implant, which you can give to the patient. That's for woman we don't born. But also for woman not born, you can use them. But before actually they decide for say which type of family planning will fit you, as I mentioned, one they get for take it easy if you don't born. But also you get medical conditioning they will go one rule out by you. Because not because it's safe, but it gets small side effect. And we want to make sure say you not get some of risk factor that will release some of the side effects that will be adverse on you. So once you go there, they go want to take a proper history. In the history for the you don't get some headache or migraine, you don't get stroke before, you don't get stroke before, you get diabetes, you get hypertension, you get any other thing like liver disease. So the medical people will take that careful history and see, and from there they go advise you which of the hormonal therapy will fit you, we go use. So as I say, you get the hormonal and non-hormonal. So they can look in either way what's best for you based on the counseling, then they give you appropriate based on your medical condition we get.
So you say after where woman don't born, when I can get a certain medicine or certain period where for take a family plan. What of the one that we just do abortion?
Yeah, so you can, well, for the one don't do abortion, then can use it that way.
Okay.
Based on the medical eligibility criteria we set. As I tell you, you get to look at age, the person they smoke, weight are left out, hypertension, diabetes, if you don't get other conditions there. In fact, they get to do a proper examination on you. It's not just what you cannot, you don't say they give you. They go do a specular examination on you, they go do even breast examination on you, they go even do scan for see if you don't get any condition within the liver. Not that is that actually for reduce the side effect. But once you get anything a day, then they can make sure you not give that a day. For women we don't do abortion. In fact, now part of the package we call comprehensive post-abortion care. Because what you don't cause the abortion, it will be certain infection, certain other condition will happen. And so you want to rule out that stigma by the patient. If you don't get abortion, no doctor no go see you, not find out what's the problem. Then probably go get that belly back, pull back again. You know what that means? It's more psychological. And that can lead to call recurrent pregnancy loss. But so based on that, we can give you abortion. We can give you contraceptive or family planning, so that will help actually we investigate you and actually for use that stigma there, so that in case next time we want to get better, if we stop that medication there, you could get better without no problem. So that's okay, as I tell you, based on your medical condition, what fit you. But if you don't do abortion, if you belly don't prepare you, we say probably an infection and you get some abnormal discharge when they come. Because also if you get too much infection, we're not going to give you some the other family planning like IUC the way you put, we're not going to give that day. We might decide based on your medical condition, your risk factor, okay, we'll put you on commando or contraceptive, we'll put you on Depo-Provera, we'll put you on progesterone only pill. So that's what we can do for them. We don't get miscarriage.
Okay, so now look at the non-hormonal type of family planning. Waiting you refer to as non-hormonal type of family planning, then how the process can like and which kind of sets of family planning follow under than they?
Well, the most time actually non-hormonal they will get like copper tea. You understand? So in the copper tea actually now a long reversible type of contraception where they can say they put coil per you. Okay. So as I mentioned, you get the hormonal type on marina, you get the non-hormonal way in a copper tea. In the last longer, once you put her, it could take around 10 to 12 years before you pull them. And the way they work is different from the way the hormone they work. Because the hormone they work by mimicking the hormone the woman gets inside the body, by inhibiting certain factors then, right from the brain, the hypothalamus, the pituitary, and even within the how they move now the tube and how implantation may take place. Now so the hormonal they work. But when you come to the IUCD, the non-hormonal, what I just mentioned, the way they work, once they put on, then they make the environment of the uterus more toxic for me, the pequeno implant day. Because once fertilization take place in the ampulla, you get for come within the 3 to the 6 and implant in the uterus. But once you get the IUCD copper T, of course they get copper. So they release copper ion, which is very toxic to the zygote or the fetus when they form for car implant. And also what they do, they inhibit ovulation and they delay the movement of the zygote from the ampulla for car implant. So now so in the work, we're quite different from the hormonal, where they work by inhibiting the hormonal system where the woman get naturally, so that the woman will ovulate.
Okay, the program now, well, Body Talk, they come to live from the Society for Radio Democracy 98.1 FM. A name now Dr. David Jalloh, in a specialist obstetrician, gynecologist, and senior registrar at the University of Salon Teaching Hospital Complex. And today inside the program, well, Body Talk, they also for talk about family planning. Options, the myth, the facts, and safety. Remember, say yourself where they listen and watch you live on Facebook. You go get a chance for be part of the program by way go send a comment or text message to the number 077981981 or self you go now already Democracy Facebook page. Where later on inside the program, with the open phone line, so people will call the number 077981981, 077981981, and the number where you go call later on and ask questions about the topic we will deal with today when our family planning options, the myth, the fact, and safety. So, Dr. Jalloh, don't talk about within our family planning and the different types of family planning. So now let's look at plenty time we don't hear people they say, oh, I take this injection. Now this they do me. Look at the side effects of the type of family planning and the.
Okay, thank you very much. So long we talk when you first start the family planning.
Okay.
Because if you not start them properly, then it not go work for you. Because you get failure rate based on how you use them. So for instance, the combined or contraceptive, how you can use them. You can use them basically when the woman they doing period from day 1 to day 5. So that it will get potent hormone in the system for make a able for protect you during the cycle, the present cycle in. So normally you can start and let me say from the 2 or the 3. And actually made up of 28 pills. You get the free hormonal medication when at 7. You can see some white, some sideways red. The red are free hormonal. So that hormonal you take on 21 days, then you take the free one. So a right for make you take them every day, you know, for the miss. So if you miss them, then what will happen? You go bleed or you go say not fit you. But notwithstanding, every hormonal therapy get only to side effect. Because the most potent of the hormonal therapy is progesterone. Estrogen day. So progesterone basically get in your way they do, way they thin the endometrium. And the estrogen basically just did it for potentiate the efficacy of the progesterone. So what did happen? Because estrogen waiting the help now for make the endometrium go. Progesterone now for relax them. So because you not get too much estrogen, what can happen? It get small bleeding. Okay. But that can happen maybe if the person is only starting for the first 3 months. But after a while, nothing will goes pass away because the system will work with them. So if you not take eye for take them, then it not go work for you, and you will begin see some bleeding will go happen. They go say, hey, what did happen? Because once you take them, in fact, the way for take them, even at the combined or contraceptive, if you miss them today, like you miss them one day, when you remember the next day, you dey take 2 medication. If you miss them for 2 consecutive days, then sooner you remember you for take them. Because if you not take them, it not go work for you. And not apart from the bleeding, then the family planning where you want to do, it not go work. You will find out say you get better. Okay. At the end of the day, you go say, oh, this year not be fit me, because you not talk them properly, the right way for take them. So you not get enough hormone actually for suppress ovulation, and so better will take place.
So how person go no say now this type of family planning fits me?
Well, as I mentioned early on, you will get expertise in all the government hospitals there. Where me work in PCMH, we get a family planning unit. I think all government hospitals are know of, and even some private hospitals, they get that family planning unit. So once you go there, you get what you call medical eligibility criteria. You fall within the criteria. If you not possible they smoke too much and you don't pass 35 years, we will know which kind of medicine we will give you. If you not possible get hypertension, we get blood disorders there, we will know which kind of hormone therapy we will give you. If you not possible get liver disease, acute one, we know which kind of medicine for you. If you not possible get like myocardial infarction, we know heart disease, we know which kind of medicine for you. Because no one give medicine where you actually increase the risk and the side effect. So now they will go able to see based on those history we don't take, they will know say this one will fit you, this one will fit you. So now something like we know they force you on them, but they give you all the teaching and everything, then you go say, okay, doctor, I want to take this one. The one thing I want to mention also, I left out, people that want to see this I pill not to a effective contraceptive. Now a temporary just contraceptive they use, not to a permanent something, because it need a fully actually suppress the ovulation system.
So meaning they try for say if you take I pill for prevent itself, you need to work?
Yes, so because people don't want to say using I pill now a form of contraception. No, I pill are just emergency. In fact, I pill you use them in case probably you get unprotected sex, you go and use them. In case probably you use condom, the condom break, you go and use them. You use I pill in case you use combined or contraceptive at a time after you say day 1 to day 5, between that time then you go use the contraceptive for making able to protect you that cycle. But if you use that beyond that 10 days, it can still work, but then you have to use emergency contraceptive pill anytime you get mommy and daddy business for make you work. Because if you take them beyond the day, you don't get enough of the hormonal medicine inside the systemic circulation. So you go find out say it go fail you. They say, that medicine they give me fail me, not work for me.
So Dr. Jalloh, how person they use I pill?
Well, you use that within 72 hours after you get sex, especially with your ovulation period, or if they use a contraceptive means where they use, where probably you not take the medicine accordingly. You miss an 210 or 310. then you feel say go work for you. You can still take the medicine as I mentioned, but then you for use an IP for at least 7 days so that it will protect you from the belly.
So IP now other one way some people refer to as emergency pill. Let's look at the safety side or the effects where it gets on that day.
Well, IP from your experience, you understand? Well, it can cause what you call amenorrhea, where you mention the disease, especially when you take them based on the time of your cycle. Because you see, if woman in cycle they in phases, you get the menstrual time, you get the time where you get follicles where they form, you get the mid-cycle, you get the secretive phase. You understand? So within the ovulation period where the eggs them actually for the woman, they come out from the ovary and can they move within the tubes. And during that time a day, if you take IP, of course, it can protect you. But not forgetting that also now a process when they take place in the body, you hormone and doing that time a day, estrogen, progesterone, then they in the high level for help you for me ovulate. So at times when you take and you find out say if you met supposed to come the 5th, you don't go can't take the 10th because you don't take some medication. We also don't go disrupt that process day. And what you do also because the way they work, IP they work, it they stop the movement of the egg from the ovary or from the tubes them. So by so doing, in some few cases we don't treat na PCMH. When we take a proper EC, the patient tells you I will take IP. And later when we diagnose and we find out say get ectopic pregnancy. So you have to be very careful how you take them and which time of your cycle you take them. And you not get for the take them all over all the time. After every sex you want to take them. After every sex you want to take them. So I mean we advise you just use them twice in a month, not more than that. Use other means, either condom, barrier methods as the case may be.
Okay, the program now well body talk they come to live from the Society for Early Democracy 98.1 FM. Today inside the program well body talk we talk about family planning options, the myth, the facts and safety. As we get the experts in the studio with we when Dr. David Jalloh in the specialist obstetrician gynecologist and senior registrar at the University of Salon Teaching Hospital Complex. And yourself can be part of the program by way go send a comment or text message to the number 077981981 or if you go on our Democracy Facebook page. Later on inside the program with the open phone line, so people go call the number 077981981, 077981981 at the number where you go call later on at the program. Ask question about the topic what they deal with today when our family planning options, the myth, the fact and the safety. So Dr. Jalloh, now look come to the myth. And plenty people they say, oh, where I take this type of family planning, it don't make a own bump, it don't make.
Well, actually, now one of the side effects, Danny, because the contraceptive, especially combined or contraceptive, they in generation. You get the first, the second, the third, and fourth generation. Okay. So the generations actually, because as I say, it made up of 2 drugs. You get the ethyl estradiol, and then you get the progesterone aspect. As I say, the potent is not the progesterone. And what in progesterone? The progesterone are analog of testosterone, where they produce androgen. And androgen get what you call antidiuretic effect. What you mean by antidiuretic effect? They make you know they able wet better, or they retain water in your system. So what they do is that some of the side effects. Now weight gain, what can happen? It depends on the generation of the drugs that we use. If you use 4th generation of drug, the amount of ethyl estradiol is high. As you go up in the generation there, it low. So like the latest 4th generation then, that side effect they win a retention of water, not there too much. So that bump they not gonna happen. But yes, it can make woman bump, it can increase the lipid, as I say, that make could do other tests for you so that in case you get some condition then we will know what to forgive you. But it's part of some of the side effects can happen in some woman because now so it will work.
Family planning gets anything for do with his sexual desire?
It's not getting nothing for do with your sexual desire because it's an exogenous substance where they actually just for modulate and mimic the natural hormone you might get inside your body. But when you come to libido itself, basically that's a whole different setup because you get hormone responsible for that and they really make you get that desire. It not get no effect. All what to do is for prevent, may not get belly, for treat gynecological condition, Like a woman can get what to call polycystic ovarian syndrome. If you get endometriosis, adenomyosis, you get fibroid, you get some big cysts, you can treat her. But you don't get nothing for able to affect your sexual desire.
So now to say if woman take family planning, plenty tell they I don't get below but join family planning.
So the first thing I will ask her first is, how you take this family planning first? Tell me to be take and win. Because as I tell you, people don't take accordingly. Because
but what do you want to take injection to say, oh, na family planning, na fail me, but it they take injection?
Well, sometimes you not go back for take the injection, because once you not take and you mean the immune system very powerful, and they come back to the normal. You understand? But if now you have the tablet you take accordingly. Yes, you get failure rate with very minimal, but if you take them accordingly, you always look. You better not go calm. Because you not take accordingly. If the injection you take, of course, that 3 months, you get forgo every 3 months you take her. Because it is suppressed and get out of the work. You understand? But if you take her the 3 month injection, wait for go take her back, you don't go. Then you wait back, say, okay, I wait after another 3 months you go. Maybe that go happen. Because you don't get any answer that the natural system go work and that will take place.
Plenty tell don't you say where woman they go for take that coil when are the non-hormonal way just when are they fall under than they say you for no force the size of your man of your penis before you go take them, because they say if you get sex they push for go inside way like you say in a danger. Not true?
Well, no, you're not getting nothing for do to that, because you see the dark coil actually feel like T-shape, either the hormonal or non-hormonal, also by T-shape. And what actually come on a thread, that thread we can show out actually now for just personally, so that in case you want to remove the coil, you could just hold on that thread and do it outside. But you're not getting nothing for do to that one day. So because the way they added the fix them, people then train at the hospital have to fix them. Once you fix in the proper way, it will work the way for work. So you're not getting nothing for do with sex or whatever the man in penis as the case may be. You're not getting nothing for do that day.
Okay, so now let's look at if person don't take family planning, then one stop for take family planning, say, oh, now I don't decide for get belly. Let's look at the period where it will take that woman day for making go get belly.
Well, it depends on the types of family planning we they take. Because if now combined with contraceptive, once you left farm within the 1 month, you natural hormone in your body, when the estrogen progesterone, where they produce from the ovary, and when you get all that thing them back inside the body, then they take up the system. I go say within 1 month, 3 months until you go get belly. But the Depo-Provera, that injection basically, yes, it can delay ovulation in some cases then. You know, because it will suppress the hormonal system inside the body short away that even though I will not take against it for make it belly, it will take a little bit while. But naturally it pass out, when it pass out from your system, then you go get the belly. But if it not happen, then probably you need to go back, make them evaluate you. Then they look at other hormones, because not to just a single hormone actually responsible for a woman get belly. A lot of hormones in there we combine together. You can look and carefully based on the test that you can say, now this one get problem, make a treat them.
Now look at the different family planning method. The way is it as for take the long term or the short term or the short term method?
Well, we can take a good history because, like as I say, me the PCMH will do a lot of cesarean section. If a woman don't do 2 or 3 or 4, 5, or let me say 4 cesarean section, you get a good basically as a doctor for advise that woman. Either you do a permanent form of irreversible contraceptive, you could tie the tube. If I left down the out also, I left out. Then, or you can use a long term, because some woman they say, no, I don't want me to tie me tube. I don't want me to tie me tube. I don't want to take hormonal medicine, you make my body big. They say, okay, we'll use the long term reversible when they are using the wiki put when I coil. But the irreversible one, that the tube that they block completely. That they don't get belly again. Because they do one basically, you know what made the woman continue to get repeated belly, where they increase the risks for make it get complications in that belly day. Either PPH, rupture uterus, or some other complications that basically will go happen to the pikin. And even for make you deliver can be difficult.
Okay. The program now well body talk they come to live from the Society for Radio Democracy 98.1 FM. And today inside the program we talk about family planning options, the myths, the facts and safety. And remember say yourself can be part of the program by way go send a comment or text message to the number 077981981 or say if you go on our Radio Democracy Facebook page. Later on inside the program with the open phone line so people will call in